The most hazardous fruits that senior citizens should never consume. There are 6 fruits that can subtly be harmful to your health. Old. Have you ever consumed something that was supposed to be healthy, only to discover that it was hurting you? Fruit is considered by many people of a certain age to be the most secure option for a snack. They have a natural sweetness and are loaded with many nutrients. On the other hand, the majority of people are unaware of the fact that not all fruits are made equal when it comes to the health of older citizens. Certain fruits, in point of fact, have the potential to mix with popular drugs, cause an increase in blood sugar levels, or bring about issues with your heart, kidneys, or digestion, particularly as your body undergoes changes as you get older. In this video, we are going to discuss 6 fruits that, according to medical professionals, can pose a surprising risk to people who are in their latter years. Furthermore, the purpose of this is not to completely dissuade you from eating fruit. For the purpose of assisting you in making more informed and secure decisions that safeguard your health, without sacrificing flavor or enjoyment. This is the goal. Medical professionals have cautioned against the use of each of these fruits for a variety of very particular reasons. Indeed, there is a good likelihood that at least one of them is currently occupying a position in your kitchen. Continue to pay attention until the very end, because the very last fruit on this list is one, in spite of the fact that the majority of people believe it to be innocuous. It has been directly connected to substantial digestive difficulties in elderly persons. When you finally figure out how it operates, it has the potential to alter the way you look at your fruit bowl for the rest of your life. It's time to get started. First, grapefruit, and the potential for drug interference. The fact that one of the fruits that is frequently touted as being heart-healthy, grapefruit, is actually one of the most harmful fruits for older persons may come as a surprise to you. Furanocoumarins are a class of naturally occurring chemicals that may be found in grapefruit. However, the influence that they have on the body is extremely genuine. Despite the fact that this may sound like technical jargon, the enzymes in your digestive tract that are responsible for breaking down certain drugs are disrupted by them, even if you are taking the appropriate dosage. Because of this interference, the levels of those drugs that are present in your system can become dangerously high. Individuals who are elderly and taking medication for conditions such as high blood pressure, high cholesterol, anxiety, irregular heartbeat, or even some pain medications are particularly susceptible to the adverse effects of this combination. It is possible that something as simple as drinking a glass of fresh juice in the morning could unexpectedly increase your risk of experiencing symptoms such as dizziness, muscle breakdown, liver poisoning, or internal bleeding without you being aware that grapefruit was the cause of these symptoms. The fruit itself is not the source of the issue here. The reason for this is that it changes the way your body processes medicine. Grapefruit, on the other hand, can have effects that endure for up to 3 days, in contrast to other dietary interactions that disappear fast. Therefore, the risk is still present even if you take your medication several hours after eating grapefruit. This holds true. A significant number of elderly people do not become aware of this until it is too late, up until the point where they are rushed to the hospital with side effects that appear to come out of nowhere. Despite what they may say, I have been taking this medication for a number of years, and they have done so. However, the equation is altered when grapefruit is included in the mixture. I'll illustrate this with an example. An individual by the name of Charles, who was 81 years old, had been using a statin in order to control his cholesterol levels before. Grapefruit juice was something that his daughter began purchasing for him because she believed it would aid in digestion and led to weight loss. He started having acute muscle cramps and exhaustion within a few weeks of the incident. In the end, his physician was able to make the connection. In his system, the medicine had been increased by the grapefruit. As soon as he avoided drinking alcohol, his symptoms began to improve. This kind of reaction is not uncommon at all. Due to the fact that it is so widespread, the majority of pharmacists now post a warning label immediately on the container housing the prescription. On the other hand, Not everyone is aware of it or comprehends the gravity of the situation. So, what options do you have? Before consuming grapefruit or drinking its juice, it is important to consult with your physician or pharmacist, particularly if you take medicine on a daily basis. In many cases, there are safer alternatives available, such as oranges or berries, which will not interfere with the treatments you are receiving. Because maintaining your health at this point in your life is about more than simply the food you consume. Another aspect to consider is how the meal in question fits into the wider picture of your overall health. Grapefruit, despite the fact that it is refreshing, might not be worth the extra danger. The health of the kidneys is the second potential risk. Bananas are frequently considered to be the ideal snack fruit, potassium-rich, portable, and satiating all at the same time. Nevertheless, this uncomplicated fruit can discreetly bring serious harm to a great number of elderly people, particularly those who are coping with kidney troubles. It is inevitable that as we become older, our kidneys may not always perform as well as they once did. In addition, when your kidneys start to slow down, they have a more difficult time filtering out extra potassium from your bloodstream after it has been absorbed by them. That is the point at which the issue starts. The amount of potassium that is contained in a single banana is quite substantial. It's a wonderful thing for the majority of folks who are healthy. Maintaining fluid balance, cardiac rhythm, and muscular function are all supported by it. Nevertheless, an excessive amount of potassium can soon become hazardous for elderly people who suffer from chronic kidney disease or even who have modest kidney impairment. Hyperkalemia is a medical term that refers to high potassium levels in the blood, and it is something that can be caused by having this condition. The effects of it, despite the fact that it could appear to be insignificant, are not even close to being so. In severe circumstances, hyperkalemia can even result in rapid cardiac arrest. Other symptoms include muscle weakness, nausea, and irregular heartbeats when it is present. In addition, because the symptoms frequently manifest themselves gradually, a great number of individuals do not become aware that they are in risk until they begin to experience a shift in their heart rhythm. The problem is that bananas are so frequently advised for conditions such as cramping or poor energy that many elderly people are unaware that they may be doing more harm than good. This is especially true if they have never been told about the importance of staying hydrated and getting enough potassium. As a matter of fact, it is not unusual to hear someone declare, "But I only consume one banana per day," and that might be acceptable for someone who has kidney function that is completely normal. One banana, on the other hand, can be too much for someone whose kidneys are not functioning as well as they should because of age or illness. I'd want to brief you on Helen, who is 75 years old. For several weeks, she had been experiencing feelings of exhaustion and dizziness. She was maintaining a healthy diet, drinking plenty of water, and taking all of her required prescriptions as directed. When her doctor saw that her lab results showed a high potassium level, he quickly inquired as to whether or not she was consuming bananas. It turned out that she had been consuming one with her breakfast each morning, on the assumption that it was assisting her in maintaining her health. Upon making a reduction in her consumption and switching to fruits with a lower potassium content, such as apples and grapes, she noticed that her energy levels began to improve. The question now is, what can you do if you are worried? If you have a history of renal problems, or if you take medications for high blood pressure or heart disease that impact potassium levels, it is important to discuss your potassium requirements with your physician for the purpose of determining your potassium requirements. You might not have to completely abstain from eating bananas, but you might have to reduce the frequency with which you consume them or the degree to which they are ripe. This is because bananas that are more ripe tend to have even more potassium. In addition, if you are someone who has never had your kidney function evaluated before, now is a wonderful opportunity to talk to someone about it. It is a straightforward blood test that can provide you with the assurance that you need regarding the meals that you consume on a daily basis. Mainly due to the fact that in this stage of life, the objective is not only to consume foods that are delicious, rather, It is to consume foods that provide support to the systems in your body that are working hard to keep you stable. I would appreciate it if you could use the second comment section below to let me know that you are continuing viewing this video and that you are finding these insights to be helpful. I strongly suggest that you subscribe to the channel and activate the bell if you have not already done so. This will ensure that you do not miss any videos. With your assistance, we are able to continue producing high-quality content that will both inform and inspire you. Now, let's proceed with our plans. Cherries and rises in blood sugar are the third potential danger. Cherries are one of those fruits that have the sensation of being very special. During the summer, they are typically consumed fresh or as a component of a dessert. They are sweet and juicy. However, they can be a concealed risk for older persons, particularly those who are diabetic or pre-diabetic and are treating their condition. It is important to note that cherries contain a greater quantity of sugar than the majority of people are aware of. Although it may not appear to be much, a tiny bowl can have a significant impact on the amount of sugar that is present in your blood. And because cherries are small enough to be eaten in a single bite and may be consumed by the handful, it is not uncommon to consume a great deal more than you had intended to ingest without even realizing it. Cherries, in contrast to processed sweets, come with a distinct health benefit. Even if they are natural, the body does not care whether the sugar comes from fruit or candy so long as it is present. Even if you have trouble controlling your glucose levels, it will still cause your blood sugar to surge. Furthermore, these persistent surges, particularly when they are not monitored, have the potential to cause harm to blood vessels, nerves, and eyesight over the course of time. The threat is not immediately obvious. After consuming them, you might not experience any negative effects. However, if your blood sugar levels rise and remain elevated for a prolonged period of time, it may result in conditions such as brain fog, exhaustion, and, in the long run, more significant complications such as kidney damage or visual problems. If you have been advised that you have elevated A1C readings or if you are managing type 2 diabetes, you need to be aware about cherries. However, this does not mean that all older citizens should avoid cherries. On top of that, the sugar level of cherry is considerably higher when they are consumed in canned syrup or as part of processed snacks. This is because the sugar content is significantly higher in these forms. The fiber that slows digestion has been eliminated for a long time. Let me tell you a story about Robert, who is 68 years old. After he retired, he began to spend more time at home, eating snacks at various points during the day, because he believed that fresh cherries were a healthier alternative to cookies. He bought them instead. His doctor noted that his blood sugar had gradually increased to a higher level than he had anticipated during his subsequent examination. Through the examination of his food record, it was discovered that he consumed more than a cup of cherries on a daily basis, which was more than sufficient to cause his numbers to skyrocket. As soon as he reduced his intake and incorporated protein and healthy fats into his meals, he noticed an improvement in both his energy levels and his blood sugar levels. When portion sizes are not monitored or when we do not take into consideration how these foods interact with the rest of our meals, even foods that are considered to be healthy can become harmful. This serves as an excellent reminder of this fact. Therefore, if you are trying to keep a close check on your blood sugar levels but you are a fan of cherries, you should try eating a little piece of them combined with a protein, such as a few almonds or a slice of cheese. The combination of these two factors helps to limit the absorption of sugar and maintains a consistent level of energy. When you take responsibility for the dietary choices you make, it does not imply that you have to give up everything that you enjoy. Simply being thoughtful, being aware of what your body requires, what it struggles with, and understanding how even the smallest of fruits can have an impact on the greater picture are all necessary components. For the simple reason that avoiding junk food is not the only way to take care of your health. It's about being aware of how each mouthful, even a cherry, can either bring you closer to strength or bring you closer to struggle. Pineapple and stomach discomfort are the fourth potential danger. There are some fruits that have the appearance of being a tropical health miracle. And pineapple is one of those foods. As well as being bright and juicy, it is loaded with vitamin C. However, for a significant number of elderly people, particularly those who have stomachs that are sensitive, it may be more bother than it is worth. Even though the acidity of pineapple is a significant factor, it is not the only one that causes concern about pineapple. An enzyme known as bromelain is the source of the significant problem. This naturally occurring enzyme is beneficial because it helps break down protein, which may sound like a good thing. However, it can also cause damage to the lining of your digestive tract, which is already rather delicate. In the event that you have ever had fresh pineapple and experienced a burning or tingling sensation in your mouth or throat thereafter, this sensation is caused by bromelain. Imagine for a moment if the same enzyme is irritating the lining of your esophagus or stomach, particularly if you already suffer from acid reflux, gastritis, or ulcers. The result is a recipe for discomfort, or even worse. Furthermore, it is not simply a matter of experiencing a slight instance of heartburn after dinner. It is possible for the acidity and enzyme activity in pineapple to cause extended episodes of inflammation in elderly people who have a history of gastroesophageal reflux disease, GERD, or hiatal hernia. Over the course of time, recurrent irritation can even develop to more serious diseases such as damage to the esophagus or internal bleeding, particularly in individuals who are already taking medications that thin the blood. Here is a story about Edith, who is 72 years old. It was her favorite way to add pineapple to her morning smoothie, and she claimed that it provided her a good kick of tanginess. However, after a few months, she began to experience recurrent problems with her upper chest, including bloating, burping, and soreness. Eventually, her physician suggested that she avoid eating acidic fruits for a period of a few weeks. Following her decision to stop eating pineapple, the symptoms almost completely subsided. The pineapple is not a bad guy. That much is true. It is a decision that can be both refreshing and healthy for individuals who have good digestion and that do not have a history of reflux. However, as we become older, the protective lining of our stomachs becomes more susceptible to damage. Furthermore, even foods that were previously simple to tolerate can become troublesome in the future. So what are your options? If you enjoy pineapple but have a tendency to have stomach upset, you might want to consider switching to fruits with lower acid content, such as ripe, melon, papaya, or bananas, provided that your potassium levels are within normal ranges. In addition, you might try boiling the pineapple for a short period of time or combining it with yogurt in order to lessen the impact of its enzymes. Maintain a constant awareness of how your body reacts to the stimuli. It's possible that a minor annoyance right now is a precursor to a more serious problem in the future. It has been your life's work to pay attention to the requirements of other people. There is no better moment than the present to pay attention to the requirements of your own body, especially when it comes to something as seemingly innocuous as a few bits of fruit. I would appreciate it if you could use the fourth comment section below to let me know that you are continuing viewing this video and that you are finding these insights to be helpful. I strongly suggest that you subscribe to the channel and activate the bell if you have not already done so. This will ensure that you do not miss any videos. With your assistance, we are able to continue producing high-quality content that will both inform and inspire you. Let's proceed with our plans now. The fifth danger is hidden sugar overload, which is caused by dried fruits. A handful of dried fruit might provide a sense of solace to the person who consumes it. In a way that is more wholesome and natural, it gives the impression that you are getting a quick snack that is superior to cookies or chips. Dried fruits, on the other hand, might be a hidden trap for older citizens who are attempting to manage their blood sugar, weight, or even their dental health. The problem with dried fruits is that they are high in concentration, which might be problematic. After the fruit has been dried, all of the water is extracted, but the sugar is still present. This indicates that a small number of nibbles can have the same amount of sugar as a whole piece of fresh fruit. and in some cases even more sugar than that. To give you an example, take raisins. Greater than 25 grams of sugar can be found in a single little box. This is more than a great number of candy bars. In addition, due to their small size and the fact that they can be chewed, it is simple to consume twice or even 3 times that quantity in only a few minutes. This is especially true if you are snacking while watching television or talking on the phone. Imagine that the same burst of sugar is occurring in your bloodstream at now moment. These increases can be harmful to older persons, particularly those who are experiencing insulin resistance or prediabetes and are managing their condition. It is possible that your body will not respond as well to the sugar, which will cause it to remain in your system for a longer period of time. This can result in feelings of exhaustion, irritability, and long-term issues if it occurs on a frequent basis. In addition, the issues are not limited to blood sugar levels. Dried fruits are another food that can adhere to your teeth. Because of their chewy nature, they become lodged in crevices, which provides bacteria with food and raises the risk of developing cavities or gum disease. When it comes to elderly people who have dental implants or gums that are sensitive, this produces the ideal storm. What about Dorothy, who is 79 years old? She was unable to figure out why her blood sugar was creeping up. Despite the fact that she was avoiding cookies and soda, she said that dried apricots were her healthy treat, but she loved snacking on them and said that they were her healthy treat. She was required to keep a food journal by her physician, and it was then that they discovered that the dried fruit was contributing more sugar to her day than any dessert she had ever had. After she made the transition to fresh alternatives such as sliced peaches or pear, her numbers began to normalize, and she no longer had the sensation that she was crashing in the middle of the day. The fact that many marketed forms of dried fruit are coated in added sugar or syrup for flavor and shelf life is another problem associated with dried fruit. It is possible for even products that appear to be healthy to have ingredients that make matters worse. Preservatives, sulfites, or additional sweets that your body absolutely does not require. This does not mean that you should never consume dried fruit again. Nevertheless, you should treat it as if it were candy. You should be aware of what constitutes a moderate portion. In order to slow down the rate at which sugar is absorbed, you should combine it with a source of protein or fiber, such as a few walnuts or a piece of string cheese. Always check the label to see if there are any added sugars. Because sugar is one of the first ingredients, it is no longer considered fruit, rather, it is now considered dessert. It is simple to fall into the trap of thinking that what is natural is also safe when you are attempting to eat healthily. Nevertheless, your body is more concerned with the impact than it is with the purpose. Although dried fruit is a natural product, it can deliver a punch that is far too powerful for many people who are in their later years to take on a regular basis. Please take a second look at the jar of dates or the trail mix that is currently stored in the pantry. There is a possibility that they are causing more harm than help, particularly if they are a regular part of your regimen. Fear is not the key, rather, awareness is the key, because if you are aware of what to look out for, you will be able to continue to eat the foods that you enjoy without allowing them to have a negative impact on your health. Unripe persimmons and intestinal obstruction are the 6th and 7th dangers. Persimmons are a fruit that most people do not give much thought to, despite the fact that they are soft, orange, and sweet when they are fully ripe. Nevertheless, if they are consumed too soon, particularly in big quantities, they can transform from a harmless snack into a significant risk to the digestive system. This risk is significantly greater for people who are in their latter years. Tannin is the component that causes the problem, and it is particularly abundant in persimmons that have not yet reached their full maturity. When the fruit is not yet ready to be consumed, tannins are responsible for its mouth-drying and bitter flavor. On the other hand, when these tannins are placed within the stomach, they react with the acid and other substances to form a solid mass that is referred to as a bezoar. You are correct. That is an actual medical phrase. And even though it may sound strange, it is not a joke. Bezoars have the potential to get huge enough to obstruct your intestines. Because they are tough, sticky, and difficult to pass through, they are sometimes removed by surgical procedures. In addition, these conditions are more likely to occur in elderly people, particularly those who have a slower digesting rate, wear dentures, or have a history of stomach surgery. This is one of those health problems that the majority of people know nothing about until it actually occurs to them. First, you might only experience feelings of bloating or nausea, but as time goes on, the obstruction will become more severe. It is impossible to eat without experiencing agony. Just a few nibbles are enough to make you feel full. If you don't even make an effort, you might even start losing weight. It is also possible that the cause will remain unknown unless a physician makes the connection and inquires about your food. In the past, I was told of a man named Walter who was 82 years old and had been taken to the hospital because he was experiencing acute abdominal pain. He had lost his appetite, and he hadn't had a regular bowel movement in days. He had no appetite at all. The physicians discovered a bezoar that was trapped in his stomach after doing scans and testing. In response to their inquiry regarding his eating habits, he stated that he had a deep affection for persimmons, particularly the kind that was firm and crisp. He had no concept that they needed to be consumed in moderation or that they needed to be fully ripened. After receiving treatment, he was able to heal, but he promised his family that he would never touch another one again. So, this does not imply that persimmons are a poor fruit. Additionally, they have the potential to be both delicious and risk-free when they are fully ripe and mushy, almost having the consistency of jelly. People are putting themselves in danger when they ingest them before they are ready, when they consume them in big quantities, and especially when they consume them on an empty stomach. Now, if you are going to consume persimmons, what is the first thing you can do? Check to see that they are pliable and completely ripe. Instead of being hard like an apple, they should feel like you are holding a water balloon in your hand. 2. Reduce the number of meals you consume in a single sitting. It is far simpler on your system to consume a small bit. Consume it slowly, and combine it with other foods. In addition, if you have ever experienced digestive slowdowns, you should consult your physician before including them into your diet. Sometimes the foods that we believe to be safe are actually the ones that pose the greatest risk. Furthermore, unripe persimmons, with their delicate flavor and beautiful look, are able to readily deceive its consumers. However, if you are aware of the potential dangers, you are in a position to make more informed decisions, ones that are respectful of the requirements of your body and safeguard your health. I would appreciate it if you could use the 6th comment section below to let me know that you are continuing viewing this video and that you are finding these insights to be helpful. I strongly suggest that you subscribe to the channel and activate the bell if you have not already done so. This will ensure that you do not miss any videos. With your assistance, we are able to continue producing high-quality content that will both inform and inspire you. Let's proceed with our plans now. Lastly, some thoughts. So, now that we've gone over these 6 fruits, each of which has its own set of hidden dangers, take a time to ask yourself how many of these are currently sitting in your kitchen or how many of them have become a regular part of your routine simply because they have always appeared to be healthy. Fear is not the topic at hand. The issue is one of awareness. Because the fact of the matter is that your body does not metabolize food in the same manner when it was 40 years old. When it is 65, 75, or 85 years old, there is a possibility that the systems that were previously able to handle sugar, acid, potassium, or drug interactions without any problems may now require a little bit more care and a little bit less probability. It is not necessary to give up all that you take pleasure in. It entails taking a second look, reading the labels, asking your physician or pharmacist a few more questions, and selecting the solutions that assist you in feeling more clear, lighter, and in control, not just in the present moment, but also in the long run. You should think of each dietary choice as a conversation you are having with your body. I am still paying attention to what you have to say when you choose what is beneficial to your current state of health. I am still concerned. This sort of self-respect, together with the kind of intelligent decision-making, is one of the most powerful things you can bring with you into this new phase of your life. However, which of these fruits did you find to be the most surprising? Perhaps it was the bananas and potassium, the grapefruit and meds, or perhaps the dried fruits and increases in blood sugar that caused the problem. We appreciate you being here with us today. It would be wonderful if you could get in touch with us. Please leave a comment below and tell us about one item you discovered today and how you intend to put it to use in your life right now. We place a high value on your opinions, so please do not be reluctant to share them with us. Our inspiration and encouragement are greatly increased as a result of reading your remarks. I would appreciate it if you would like, subscribe, and share this video if you found it to be informative and enjoyable. With your assistance, we are able to continue producing high-quality content that will both inform and inspire you. We appreciate you taking the time to watch, and we hope to see you in the future video.